Hi, my name is Mohammad. I'm the Infection Control Practitioner here at OakBend Medical Center, and we just wanted to do a short video for our Immunization Month.
What is the importance of immunizations?
So the basic principle is that it's much better to prevent a disease than to have to treat it. So that's the whole principle of vaccinations and immunizations. And a vaccine is a great substitute for a child or adult's first exposure to a disease. So what they do, immunity in general, what happens is that they take a weakened disease germ and then they introduce it to the body, and then the body produces an immune response to it. The response is remembered by the body. So when the actual disease germ attacks the body, it's a very effective response that the body puts out. So that's how the whole process works. There is something called herd immunity, which is important to know. That's where if a large chunk of the community is up to date with their vaccinations, then it gives less of a chance for the disease germ to find vulnerable people to attack. So you have a community that's up to date, and then you have great herd immunity. So then you have less diseases, vaccine preventable diseases that spread.
What are some serious diseases that can be prevented by vaccines?
Right. So the diseases that come to mind are measles, mumps, pertussis, rubella. These were serious diseases that were common back in the day, but with the introduction of vaccines, this whole category of vaccine preventable diseases has really gone down in incidence, in numbers. Other than that, there are also, hepatitis A, hepatitis B, certain types of pneumonia, certain types of meningitis. They all have vaccines. So depending on the age, the doctors will recommend certain vaccines to be given to the population. CDC has a great immunization schedule, and they divided it up by the age group. The very young, the teens, and the adults. So just look at that, and then you can follow that to make sure that you're up to date.
Are there any vaccines that I need to get every year?
So the flu shot comes to mind. OakBend is getting ready to start giving the flu shots to the employees and also the inpatient population. That's a great one that should be received but every year. And then also Tdap, that's a tetanus, diphtheria, pertussis vaccine. If someone has never had it, they should at least get one dose of it. And then the tetanus booster, the TD, is given every 10 years or at the time of an exposure to tetanus. So after Harvey, people were in floodwaters, there's a risk of tetanus exposure, so then they would receive it after that. If someone is pregnant, with every pregnancy, the Tdap is recommended for the person to receive.
With the recent news on measles, should I be concerned?
Yeah, so what the incident that's being referred to here is the child. City of Houston put out a news release on this incident. It's a 1 to 3 year old child that was diagnosed with measles, and it doesn't happen very often. The last time it happened in City of Houston was 2013. So it was big news here. And one thing to remember is City of Houston is geographically separated from Fort Bend County, so you have a little bit of distance there. So it's not as much of an urgent concern here. But outbreaks do happen of measles. DFW, Arlington was dealing with one a few years ago. So in the case of that child, the child was contagious between August 14th to August 24th. So exposure to the public would have happened then. But the health department reaches out to people that may have been exposed. So if you have not been contacted yet, then the risk is minimal, really. So that's dealing with that. The main concern, though, is that there's a trend where parents do not want to vaccinate their children, and that's a dangerous trend for public health. It reduces the herd immunity, like we talked about. And for something like measles, the newborn cannot get the shot until they're 12 months of age. So it's important to remember that the more family members, the more community that has been vaccinated, the more that newborn is protected. So thank you so much for watching.